Halo, Assalamualaikum warahmatullahi wabarakatuh. Selamat datang kembali di channel saya. Sekarang saya bersama dengan Profesor Gutenbrunner. Sekarang kita akan mendiskusikan tentang bagaimana sih health system atau sistem kesehatan di Jerman. Mungkin nanti kita akan belajar ya, dan mungkin ada beberapa poin yang bisa diadaptasikan ke Indonesia jika itu bisa dan juga relevan untuk kebutuhan di Indonesia. Makanya saya mengangkat topik tentang health system di Jerman. Dan beliau adalah salah satu yang cukup punya pengetahuan karena kita juga pernah di sini di departemen ini, Departemen Rehabilitation Medicine, Hannover Medical School, punya penelitian tentang health system, sistem kesehatan, tapi lebih ke arah, walaupun lebih ke arah rehabilitasinya. Tapi tentunya beliau tahu juga secara general prinsipal, karena sebagai medical doctor, beliau juga mengurusi tentang asuransi-asuransi dan hal lain-lainnya terhadap pasien. Nah, without other ado, I think we need to start. Ya, Prof. Gutenbrunner, again once more, thank you very much for your time. Today we would like to discuss about German health system because I think this is very important. Yeah, because let's say although Indonesia already established universal health coverage, BPJS in Indonesian, yeah, but somehow. Although I think it works quite well, but when we were in WHO, I think in 2017 or 2018, the representative in Indonesia, he said we already reached 85% of Indonesian population. It is quite a lot. However, they now face some deficit in the financial situation because of this one. So maybe if we can learn from German health system, at least let's say the basic principle, because if we discuss into the detail, will take maybe months, yeah, like that. So, Professor Gutenbrunner, maybe at the first step, we would like to know from you, how is the German health system historically developed? Yeah,
Yes.
please.
Yeah, this is a very important point, but maybe before we start with that, one thing, the health system, of course, is the delivery of health services, interventions, and on the other hand, as a very important point, how this is paid or how the financing system is done. And we talk about the second one today. And about the history. This originates from the late 19th century. So it's quite early reform. We called it the reform of the social system, which is mainly used by the chancellor at that time, who is called Bismarck. Maybe you heard about this name. And interestingly, Bismarck is not a socialist or someone who said, well, we need to have equal situation for everyone, something like that. But he had another intention or observation. What he intended is to improve the life situation of workers, of employees, of workers, because he wanted to have a stable social situation. So not primarily to help the people, but to have a smooth social mechanism, let me say like that. And he was very clear about that, that of course the health of workers is an important factor. And it is also a factor to avoid poverty and many other things. So he developed a concept which is a multidimensional concept, on the one hand on health, but also, maybe we come back to this later, also with regard to accidents at work, which is also a problem at that time in the early history of industry. This also was a situation. So this comes from the view that health is important to have a stable social system.
Okay, this is very, very interesting. Maybe now also in many of the countries worldwide, think about this basic principle, because in the COVID situation, we really can apply this principle. But now maybe we need to go on to the next step. How about the basics principle itself in Germany?
And this is, I think, also a very good one, which is still in our days maybe is a principle that really can be used to solve this problem. And one of the principles is that the health insurance should be open for everyone. So every inhabitant of Germany should have a health insurance.
Including foreigner who comes to Germany.
Including foreigners who comes to Germany. So health insurance is not voluntary, it's mandatory.
Okay.
So in Germany, you are obliged to have a health insurance.
No matter it is from state or private.
Yes, yes. This comes later, but the principle is that everyone should be insured.
Okay.
That have health insurance. The second one is the contribution to the insurance. So many insurances are risk-oriented. So if you have higher risk, you have higher payment for the insurance. Okay. This is one of the main principles, but this principle here is different. Okay. And that's very important, that the contribution to the health insurance that we call the legal health insurance is dependent on your income.
Okay.
So if you have less income, you pay lower contributions to the health insurance. If you have higher income, you pay more. So a very important principle. And the second part of this principle of contribution is that this is shared by the employer and the employee. So both parties invest in health of the workers, which is then, of course, enlarged also to people who are not working. This is the second very important. The contribution depends, and this is a point of justice, depends on the level of income.
Okay.
But on the other hand, what is paid by the insurance is similar for everyone. So if you are rich or if you are poor, the health services you get is the same. Also very important because this is a needs-oriented patient. So if you, for instance, are poor people, you need organ transplantation, this will be paid. If you're rich, organ transplantation will also pay. But you have no dependencies of the payment to what you have paid into the insurance. And this is, I think, very important for a health insurance.
Can I ask you before we continue, yeah? Because you said the contribution to the insurance is depend on the income of the person, yeah, and then it also the employer also even also contribute to this insurance payment. Yeah, but now my questions is because you said every person must have the same services itself. But maybe the difference is the facility. For example, the room facility.
Yes. Yeah.
Okay.
Yeah. Well, you already talked about the exceptions.
Exception. Yeah.
On the
but
one
maybe
hand,
need to be clarified.
The basic principles are, I think, very clear. And of course, after 150 and more years, some things change because we also have to be aware that such a system has some inherent problems. We should not say that that is not the case. And of course, there are some problems, and one of the problem, the development is that there are exceptions. So we have a principle and we have exceptions. And what you said is the exception that for persons with higher income, they can leave the system and go to a private insurance. And this so-called private, not mandatory insurance has a different principle because they pay, what you have to pay, what you have to contribute is related to a health risk, which is the classical principle of an insurance. And this leads to the case, if you have a private insurance, the contribution gets higher the older you get.
Okay, yes.
Yeah, so because your risk is getting higher. And if you have a disease, a chronic disease, and want to enter a private insurance, they say you have a higher risk, you have to pay more. This is the exceptional system that also exists in parallel and of course harms a little bit the principle I said. But the basic idea was that everyone should have the equal distribution. And of course then we also have standards for the health interventions that also should be the same in the private insurance, but the way it is delivered is a bit different. So in hospitals you have a single room, not a room with 3 patients and some things like that, as you said. But this is, let's say, beyond the principle, some changes that have been made. And also we had some political discussion if the employer pays 60 and the employee 40%, or the other way around, or you have to contribute with 10 euros per medical intervention or something like that. So this principle is not kept so clear as it was in the beginning, but we try to stick to this principle because it's very good.
Okay. This is very interesting, yeah. Of course, it will be fair enough, yeah, if people contribute to the insurance itself according to the based on their income. This is will be very good.
And also the principle that anyone must have an insurance. Because if you are young and healthy, maybe you think, oh, there's no need of an insurance. But it is also that the young people must be enter the insurance, and it is also a principle of justice, because those who are healthy earn a lot. They also have to take care, let's say, in the end, for those who are not. And this is in a system. Maybe one more detail is of interest, that in the insurance, so if one person in the family only is employed, the other members of the family also are insured. So the children are included in this one without extra payment.
So in one, let's say, household can have one insurance, it will cover everything. Okay. So very good, yeah. Because in Indonesia, I think one type of the insurance itself, the insurer can choose which type of, because I think we have 3 classes of insurance in Indonesian insurance, but I need to clarify again with my colleagues, but it is, we should choose at least. But yeah, so thank you. But now maybe could you please a little bit elaborate about the areas of the insurance itself in Germany?
Well, as I said in the beginning, this is a social systems reform. So health is only one part of it. There are other risks, and over the years, it's not have been in one year. Over the years, there was a system of insurances for different types of, let's say, social and health risks. So the one is the health services, which is the health insurance. This is medication. This is the treatment by the doctors, but it also includes physiotherapy, occupational therapy, and other things that even assistive devices are included in this insurance. So for this sector, we have the health insurance. But we also have another insurance as soon as it also comes to rehabilitation, which has a quite different principle or even goal, which is the pension insurance. So we have an insurance that is dedicated to pay the pension after retirement. So that also the risk of poverty after retirement has a certain principle to be avoided. Even this does not work 100%, but the principle is there. And for the pension insurance, this is the same principle that employers and employees pay half of it, and in the end, you can get the pension payment from that. If you are sick and unable to work for a long time, for instance, have a limb amputation and you cannot walk anymore, or any other thing like that.
Can you please mention about the long term? Where is the shortcut? 6 months?
No, well, it depends a little bit on the prognosis. So if there is, for instance, an internal disease like diabetes, the prognosis is to be treated and improve again. It's different as if you have, for instance, a limb amputation or something like that. But even there, you can compensate by wearing a prosthesis. So this is not a clear cut. It depends on the situation. But what the principle there is, if you have a long-term or permanent inability to work, the pension insurance also has to pay pension earlier. So we have, in this case, for health reasons, there can be an early pension payment. But this is very costly. For instance, if you have a 30-year-old woman or man after an accident or something like that, it could be for a very long time, this payment. That's why the pension insurance decided we try to avoid this early pension payment by strengthening health or doing rehabilitation.
Let's say including the prevention of functioning that we discussed.
Yes, the prevention of the situation that persons will be having a kind of long-term impairment or disability. They cannot participate. So this is again let's say a financial strategy that led to the situation that the German pension insurance pays for rehabilitation, but only for people who have the chance to go back to work. This is a limitation. So some part of and relevant part of rehabilitation is paid by the pension insurance, which is very specific. Then we have two other parts. The one is the insurance for unemployment. So if people getting unemployed for sometimes they can get money also from the insurance. We call it the Arbeitslosenversicherung. Which is also a risk, which is, by the way, paid by the employer only. The employees do not pay for Arbeitslosenversicherung. So this risk is also included in that. And of course, for basic social needs, we also have which is not an insurance, so the state can pay for that. If any other systems do not work, then there is a payment of some, basic social needs, which is really very basic. And there's a lot of discussion about that.
So you mean the social needs or basic social needs, just like, because in Germany also there are some people who live on the street, like say like that.
Yes, some of those even do not apply for that. That's another
it needs to be applied.
Yes, you need to be applied. But
with certain conditions,
the problem is that the conditions really are, it's very, very basic, and the money is not enough for a good life, to say like that. This is, I think, a weakness in our system. And then one last point.
Maybe because we go to the last point, because I have a friend, he was diagnosed with multiple sclerosis, and then the German government, I do not know which of department, said to the employer, you must not kick him out of the company. If the situation actually, who will support the financial support for this type of person?
But there are, of course, many of these details which are very important. For instance, the pension insurance also can pay adaptation of the workplace.
Even adaptation.
Even adaptation of the workplace. And we also have the situation, for instance, for some health situations, health conditions, that we say a person can reduce the daily work time to half. So 50% then is paid by the salary and 50% is taken by the insurance. So there are many mechanisms like that, and it depends a little bit on that. And we also have a mechanism, we call it the disability passport or something like that. And with that, for instance, you also have some chances within your company to have some specific rights to do that. So there are many mechanisms in some of these insurances. And our principle is, of course, and I think it's a very important one, having a disease, a chronic disease, or experiencing disability must not say you should not work. So, for instance, a person with spinal cord injury, many of them want to work and many of them can work. And even in Germany, the employment rate is not optimal. We still have some problems because sometimes, and this is to work with all these aspects, sometimes you get the same money if you are not able to work as you are working in this situation of disability. And that's why sometimes the motivation to go back to work is a little bit lower.
Yeah,
so
okay,
there are
see.
many detailed problems in that, but I think the basic principle is very well solved in German.
Thank you very much. This is very interesting. Maybe we also can learn from what he already mentioned about this one. But of course, if we would like to know the detail, it will take a long time.
Yes,
as I mentioned, maybe months. So now, because we are in the rehabilitation field, I would like to ask you, how about the payment for the rehabilitation itself?
Well, I already mentioned one. The basic principle is that if a person is in risk of not being fit for work for a long time, then it's a pension insurance. There's a special mechanism for that. But of course, also health insurance is included in that. So we say if pension insurance is not responsible, health insurance must pay. But it is also dependent on the phase of rehabilitation. So rehabilitation in the acute phase in hospitals is paid by health insurance. Post-acute rehabilitation is partly paid by pension insurance and health insurance. And for the long-term rehabilitation, it is also health insurance and pension insurance, depending on the situation. So the rehabilitation is almost the same, but the payment may be different. And I should not forget, because very often we forget it, there is another type of insurance, which is the workers' compensation insurance. And that comes in if there is an accident at work or a work-induced disease. For instance, if you look at the miners, the lung disease of the miners, or if you work with chemicals, you can have some diseases. And if this is work-related, this insurance has to pay. And this is the contribution to this insurance is purely the employer, but the employees can get this compensation there. And this is a very comprehensive system. Because they pay also for the post-acute, they pay compensation, they pay many things, and they have their own departments. And they are a little bit, the level of compensation there is a little bit above the other insurances. There's a very specific mechanism, which interestingly also is for accidents you have on the way from home to work. This is also included. So if you leave your house, going to work, from that time point, the workers' compensation insurance is responsible if there is any accident or something like that. This is a very specific system, but this shows that we think that the companies are responsible for health, and if they harm health, they must do something. They are responsible for that. This is their responsibility for the health of their employees. And if they do not care for it and something happens, they have to pay. This is also an interesting principle, maybe at the end.
Yeah, that's very good. So when you mentioned about the workers' insurance,
Yes.
Maybe in Indonesia it is almost similar with the labor insurance in Indonesia.
Yes.
Because
be like that, yes.
now Luh Karunia Indonesia try to implement the rehabilitation treatment for the workers by taking the payment from the labor insurance. Because previously the labor insurance never done for the rehabilitation.
In Germany, they, let me say like that, they do have a optimal rehabilitation system because they integrate the different phases of rehabilitation. You see, in the other systems, we have the acute rehabilitation is health insurance, then maybe the post-acute is pension insurance. So we have a switch between the systems, which is sometimes a problem in these interfaces. But the workers' compensation insurance, they take all responsibility for all the rehabilitation issues. And this is a very good system. But it's also a expensive system, say like that. But it really makes sense, and all these kind of insurance makes sense even economically. So because if you have fit workers, let me say like that, without having sick leave and things like that, also your company will work well, and this is a contribution to the economic growth even of the country. So it makes sense, these principles. And that's why I introduced with the history like that, because it's on the one hand, of course, we have the human rights aspect, and health is part of human rights. And also rehabilitation is included in that, but it also makes sense for the economy. And so both things can get together, and we should not say the employers, well, you have to pay, and it is not good for you. It's good for them if they pay.
This is really a good system, I think. But maybe, before we end, I would like to ask a more practical issue as insurer myself. For example, if something happened to me, because mostly foreigners did not know about the regulation of the insurance in Germany. Do you think the insurance company itself who will decide whether I will use the health insurance or pension insurance or worker insurance when, for something happened to me? It will be as the insurer myself do not need to do anything, or need to apply something.
That's a very important point. And for health insurance, it is very easy. Because if you have the insurance, you go to the doctor, and you do not even have to pay, because the doctor gets the money directly from the health insurance. So I think for this health system, it is very even if you go to the hospital will get the money directly from the insurance and will not write a bill for you. So this is, I think, quite easy. It is more difficult with the rehabilitation. Because rehabilitation and even some assistive devices, you have to make a special application, which is difficult to do. And that's why we had, for instance, with the Medical Center here in Hanover, we developed a kind of concept. So for those who are not able to talk and read German, we made some explanations how to apply to that in different languages. We have 8 languages. Unfortunately, we do not have Indonesian language, but maybe in future you will take care of it to explain this. So for the basic and even hospital health services, it is very easy. For the other parts, it's difficult, and we need to work on to explain it to foreigners coming here.
Okay, I see. Yeah, because I remember when I had a surgery, for example, I need crutches actually at the time, because the doctor directly prescribed this one, so I myself do not need to do anything.
Yes, for those post-acute phase, these crutches were post-acute rehabilitation, if you want to say like that. But for instance, if you have a long-term impairment and you need a wheelchair, then from time to time you have to apply. And then the discussion is, do you need a simple wheelchair? Do you need an electrical wheelchair? Or do you need, for instance, if you like to do the sports, and if you have a sports wheelchair, then the insurance will say, yes, we pay the price of a basic wheelchair, but you want to do the sports, you have to invest. So these things then get very complicated. So for those standards, it's well, but you can imagine that many discussions then come into the detail, especially if it is for the long-term care.
Yes. As you always mention, that the devil is in the detail.
Yes.
So I think we learned quite a lot, but maybe a lot of us would like to ask more. But I think because we are short in time, so we cannot continue. Otherwise, we will not have a break and cannot go home. So, Professor Gutenbrunner, again, thank you very much for your time and your knowledge. I hope many people also can get benefits from your explanation. So, thank you very much. Have a good day.
Thank you.
Bye-bye.